Welcome to another deep dive. Today we're going to be talking about a recent study on adenovirus infections after allo-HCT.
Yeah, this is a good one. Adenovirus infections, they're pretty common, right?
Yeah, definitely.
But in immunocompromised patients, especially those who've just had a transplant,
Yeah,
things can get a lot more serious.
and that's exactly what this study digs into.
Yep, it was published in Bone Marrow Transplantation journal, and it uses data from the European Society for Blood and Marrow Transplantation registry.
Oh, wow, the EBMT registry.
Yeah, and that's a huge data set.
It is, it covers over 2 decades, right? For 2000 to 2022.
Yeah, right.
And they included a massive cohort of patients, over 2,500.
2529 to be exact,
Anyway.
with adenovirus infection post-transplant.
So that means we're dealing with a really robust sample size here,
Right.
which is important
Absolutely.
for drawing meaningful conclusions.
Definitely. And one thing that's interesting right off the bat is the breakdown of the patient population.
What do you?
Well, about 44% were children and 56% were adults.
Pretty even split there.
Yeah, almost.
So this study offers a good look at how these infections differ between age groups.
Yeah, I think that was one of the main goals of the study, to see if there were any differences in how adenovirus infection presents and what the outcomes are.
Makes sense. Children and adults, their immune systems work differently.
Right. And they also have different risk factors for certain complications.
So having a large sample size of both groups is crucial for teasing out those nuances.
Exactly.
So before we jump into the nitty-gritty of the findings, I think it's important to understand how the study was designed,
Yeah, let's talk about the methodology.
because that'll give us context for the results and their implications.
Absolutely.
So let's transition to the methods section of the study
Okay.
and break down how they actually went about this research.
Sounds good.
Okay, so walk us through how they actually did this research.
Well, it was a retrospective registry-based study.
So they weren't following patients prospectively.
Exactly. They were basically looking back at data that had already been collected.
Okay, so they delved into this massive EBMT registry
Right.
to pull out information on patients with adenovirus infection after allo-HCT.
Yep. And they looked at a whole bunch of factors.
Like what?
Patient demographics, for one.
Okay, so basic stuff like age, sex, and things like that?
Yeah, and also their primary diagnosis, the reason for the transplant,
Right, of course.
and then details about the transplant itself.
So like donor type conditioning regimen, those sorts of things.
Yep, all of that.
Pretty comprehensive.
And they also looked at things like GVHD graft versus host disease.
Right, because that can be a major complication after transplant.
Exactly. And other infections besides adenovirus, like CMV.
Makes sense. We know that these patients are often dealing with multiple issues at the same time.
Right, so they wanted to see how all of these factors might be related to adenovirus infection and its outcomes.
And then, of course, they looked at the adenovirus infection itself.
Right, like what type of infection it was.
So was it viremia, pneumonia, gastrointestinal, all that?
Exactly. And how severe it was.
And most importantly, the outcomes.
Yeah, did the patient survive? How long did they survive? What were the causes of death?
So a lot of data points to consider.
Definitely.
And I imagine they used some pretty sophisticated statistical tools to analyze all of this,
Oh, yeah, they did. They used Kaplan-Meier survival analysis.
which helps visualize survival over time, right?
Exactly. You can see the proportion of patients surviving at different points after transplant.
Helpful for getting a sense of the overall prognosis.
Yeah, and they also used a Cox proportional hazards model.
Now, that's a mouthful.
It is. But it's basically a way to identify factors that are associated with an increased or decreased risk of an event.
So in this case, mortality from adenovirus infection.
Exactly. They can plug all these different variables into the model and see which ones are most strongly linked to survival.
Powerful stuff.
It is. It lets them tease out those really important relationships in the data.
So now that we've got a good handle on the methods, let's dive into the results.
Okay.
What did they actually find? What were the key takeaways from this massive study?
Well, there were some really interesting findings, some things that were expected and some that were a bit more surprising.
Ooh, I like surprises.
Well, let's start with the basics. What were the most common types of adenovirus infection they saw?
So what were the most common types of adenovirus infection they saw?
Well, the most common was viremia,
Viremia.
meaning the virus was present in the bloodstream.
Oh, so a systemic infection.
Exactly.
Wow.
That accounted for a whopping 63% of the cases.
Wow, that's a majority.
Yeah, it is. The second most common presentation was gastrointestinal infection.
Ah, so like diarrhea and things like that.
Right. That was seen in about 17% of the patients.
Okay, so those two presentations together make up the vast majority of the cases.
Yeah, pretty much. And then there were a few other less common presentations like pneumonia.
Right.
hepatitis.
Okay, but viremia and GI were the big ones.
Definitely. Now, here's where things get really interesting.
Okay, lay it on me.
The study found a significant difference in survival rates between children and adults.
Oh, really?
Yeah, at day 100 post-transplant.
Which is a key benchmark.
It is. The overall survival was 79.2% for children,
Oh, wow.
compared to 71.9% for adults.
That's a pretty notable difference.
Yeah, it is. It suggests that children might actually be more resilient against ADV infection after transplant.
Fascinating. So age plays a big role then.
It seems to. Now, when they looked at the factors that were associated with mortality,
Right.
they found some interesting differences between the age groups, too.
Okay, tell me more.
In children, the main risk factors were CMV seropositivity.
So whether the donor or the recipient had been exposed to CMV before.
Exactly. And a lower performance score.
Meaning they weren't as healthy going into the transplant.
Right. So basically for kids, it seems like the pre-transplant factors were really important.
Makes sense? I mean, their immune systems are still developing?
Right. Now, for adults, it was a bit different. The main risk factors were more related to the ADV infection itself.
Okay, so like how severe the infection was.
Exactly. For example, having viremia or pneumonia.
So more serious presentations.
Right. And also having a second or later transplant.
That makes sense. I mean, they've already been through so much.
And then another key factor was the timing of the ADV infection.
Timing.
Yeah. If they got the infection early on, like within 30 days of the transplant.
That's when they're most vulnerable.
Exactly. Their immune system is really suppressed at that point.
So it seems like for adults, it was more about the acute phase of the infection.
Yeah, and how their body was handling it.
Really interesting stuff. Makes you think about how we approach these infections differently depending on the patient's age.
It does, definitely. And this study, it really highlights the importance of regular ADV screening.
For both kids and adults.
Especially early on after the transplant.
Catch it early.
Exactly, when they're most vulnerable.
Yeah.
And knowing the specific risk factors can help us tailor our screening and management strategies.
So for kids, we'd focus on CMV status and overall health.
Right. And for adults, we'd be extra vigilant for those early signs of infection.
This has been an incredible deep dive. I feel like I've learned so much about ADV infection after transplant.
It was my pleasure to break it down with you.
And to our listeners, thanks for joining us on another deep dive. We'll see you next time for another fascinating deep dive into the world of medical research.
See you then.